My presentation is going to be on continuing education for nurses. Why do nurses need continuing education? It is mandatory to keep your license. Each state does mandate their requirements for continuing education for nurses, so make sure you are up to date on your policy through your state, especially if you plan on moving to a different hospital in a different state. You want to be updated with that so you are educated on what to expect, because maybe a difference in hours or maybe different types of classes are for a certain hospital versus the one you were already at. But nurses are expected to be up to date with the newest information, and we are trying to improve the patient's outcomes through education, and we are trying to provide the overall best healthcare possible, and that is done through education. We have to stay updated and we have to stay as a unit so we can help provide for our patients, because patients are becoming sicker and they're having more complex diseases, and we need to know about those to help them. So state regulations on nursing education, like I said, each state does regulate their education requirements, so make sure you are updated per state. But Louisiana, their policy is based on employment status. So if you are a full-time employee, you only have to do 5 hours, and if you are part-time, it's only 10 hours, and if you're not employed or work less than 160 hours in the past year, it's 15 hours. And you can get these hours through different classes, maybe your hospital offers, or different classes that is considered credible and will count towards your nursing education. And there's different webinars and different things you can do to get your education. So topics discussed in the courses, they could be a wide range, but some general ones that I picked up were maybe popular diseases or conditions such as Alzheimer's, dementia, seizures, things that you will more likely come into contact with, so they want you to stay updated with the newest information about that. Maybe things to help us as nurses, like mobility for fall risk and how we can properly assess those, and maybe new devices for immobile patients, such as a bed that turns itself every 2 hours. Infection control, what can we do to control infection and make sure our patients are safe? And they can also be tailored to your specific area of work. So for example, having a new ventilator for an ICU patient is something that needs to be addressed to an ICU nurse. You need to be adequately trained and educated to learn about that. Or maybe domestic violence signs for a women's health nurse, maybe a labor and delivery nurse. You need to know those things and note those things so you can be educated and know what the next steps are in the process. So some benefits of continuing education is it keeps your knowledge up to date, it keeps it fresh in your mind. It also allows nurses to provide higher quality patient care, and it allows nurses to implement the newest evidence-based care practices. So we're able to take those new practices from other nurses in its work and bring that to our facility and allow that to benefit other patients. And it helps you just become a reliable member of the healthcare team because you are educated. So for the BSN Essentials Connection, I chose the interprofessional communication and collaboration for improving patient health outcomes, because effective communication and collaboration is essential for effective patient care. And you have to have a proper education to work as a nurse and provide better patient outcomes, and it's done through communication. We're able to communicate to other nurses, hey, what has your hospital implemented and that works? Well, great, I'm going to bring that to my hospital as well and see if we can help improve patient outcomes that way. So just really good communication and collaboration. And also for the quality and safety education for nurses, I chose safety and quality improvement. Safety to minimize the risk of harm to patients, and that's done through education. We're able to find different things that maybe have been mistakes, and we're able to educate ourselves on what we can do to prevent those mistakes. And then for quality improvement, we are using new techniques and practices so we can improve the quality for our patients, and that's done through education. And those are my references.